Hello! So we're gonna go over some obsessive compulsive and related disorders. Okay, obsessive compulsive and related disorders. So I'm gonna go through obsessive compulsive disorder a bit more thoroughly and body dysmorphic disorder. So I'm just gonna briefly explain what the other ones are so that you recognize them. So starting with hoarding disorder, a hoarding disorder where somebody has trouble, it causes a significant amount of distress to discard items or get rid of items, even when the items themselves do not have actually any real value to them. This can often be a part of obsessive compulsive disorder. You'll see that many people with obsessive compulsive disorders may also hoard, but you can see that people with a hoarding disorder don't necessarily meet all the criteria for obsessive compulsive disorder. I want you to note that it's this perceived need to save something, and just the thought of getting rid of something would cause them intense, again, distress, disability, or both. Sometimes you'll notice that people with this disorder have health or safety issues. They have maybe materials in their house that could pose a fire risk. They could injure themselves tripping over materials. They could feel very anxious about their possessions. Next, we have trichotillomania. This is a hair pulling disorder. So it's a type of OCD or related disorder. And what the person has are these recurrent, irresistible urges to pull their hair. It could be from their scalp, their eyebrows, their eyelids, and other areas of their body. What will happen is they'll experience obviously hair loss, like bald patches maybe on their scalp, and as such, it could interfere with people's social lives, their ability to function in that way. They're not pulling hair necessarily from areas that somebody would want to say tweeze or shave. It's usually more in a noticeable spot, and it can cause a significant amount of distress. So excoriation disorder is really like a skin picking disorder. It's again related to the OCD category. It's categorized by picking at your skin, and it results in like skin lesions and can cause a significant disruption in your life. I want to note here that it's not uncommon for somebody to say pick at a scab or the skin around their nails, but is it becoming so frequent and intense that it causes bleeding or sores and scars? So are you repeatedly trying to scratch and remove something? So I guess, when it gets into that disordered realm, and that's what it's hard to see from just looking at the symptoms here without knowing. But does it take a lot of time during your day? Do you have noticeable scars from the skin picking? Do you feel upset when you think about how much you pick your skin? Does it interfere with your social life, your work life, your school life? Do you avoid going to the beach or the gym or anywhere where somebody might see your scars, or do you spend a lot of time trying to cover them up? That would be entering more of the disordered realm with this stuff. Substance or medication-induced obsessive compulsive and related disorder would mean that you have the signs of OCD or the symptoms of OCD because of the use of a substance, a drug, a medication, or the withdrawal from one. And last on this list, obsessive compulsive disorder due to another medical condition. This is where you really get into the world of PANDAS. So I don't know if you're familiar with that. PANDAS is short for pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So a child sometimes gets diagnosed with PANDAS when they get OCD or some type of tic disorder, and it suddenly appears after a strep infection or scarlet fever, something like that, that has kind of gone out of control. This would be treated the standard way you would treat OCD, but also with antibiotics. Okay, so obsessive compulsive disorder, I want to point out this first part here. So either obsessions or compulsions, very frequently both, but it could be one or the other. And I'll break down what that looks like. But at this next point here, the person has recognized that the obsessions or compulsions are excessive or unreasonable. That's really important, because when you see somebody who's struggling with obsessions or compulsions, I think very frequently people point out to them that, nothing bad's going to happen. It doesn't really matter if you do that or not, etc. They already know that. So pointing it out actually just dries up their anxiety and tends to make the symptoms worse. It's not actually helpful at all to do that. In the same way, it wouldn't be helpful to tell somebody that's really angry to calm down. And then lastly here, these obsessions or compulsions cause marked distress and are time consuming. By time consuming, we're really looking at like an hour or more a day. So starting with the obsessions, obsessions are the thoughts that go with it. So these recurrent and persistent thoughts, impulses, or images. The thoughts, impulses, or images are not simply excessive worries about real life problems. The person attempts to ignore or suppress or neutralize the obsessions, and the person recognizes the obsessions are a product of their own mind. Remember that. They know that it's a product of their own mind. That's not what this is about. So just a note here, this disorder is equally common in men and women, and some of the things you might see on the thinking side, on this obsession side here. It's like thinking bad thoughts might cause something to happen. Being afraid of saying what's on your mind, or thinking something inappropriate, like having inappropriate sexual thoughts that really bother you, or religious thoughts, or what have you. But these thoughts are going to be uncomfortable. You're going to spend a lot of time trying not to think about them. It's often going to drive up somebody's anxiety. Okay, so on the compulsion side, compulsions are behaviors. Obsessions are thoughts, compulsions are behaviors. So you have repetitive behaviors like hand washing, ordering, putting things in order, checking and rechecking stuff, mental acts like praying, counting, repeating words silently, and the person's going to feel driven to perform them in response usually to an obsession. They're trying to block some type of thought. It's aimed at preventing or reducing distress or preventing some dreaded event or situation. However, these behaviors or mental acts are usually not connected in any realistic way to what they are trying to neutralize or prevent. I think one of the most important things I want to make about this disorder is that it gets used all the time and inappropriately. So somebody would be like, oh, they like to have everything, like maybe be a neat freak, or as Freud would say, they're anal with their stuff. You know, they like everything a particular way. That's not what OCD is. You notice that somebody could have a compulsion to order stuff, but very frequently people with obsessive compulsive disorder are not all that neat. So liking something and having it in a particular way, that's that's just a personality preference. Having it be so distressing that it takes up a significant amount of your time, that's different. And so I'll give you the example, and this is really before kids because everything has changed since I've had kids. But before I had kids, I used to like to keep my stuff just meticulous. Like, so if I were folding my laundry, I'd fold it over a clipboard, I'd line it up by color in my closet so I could just like look at everything in these nice, perfectly lined stacks. Hang it on hangers, all the same type, everything facing the same way, all like things sort of together, skirts are with skirts. I'm not hunting for anything. I liked everything to be where it was, and that was true of like what I would put in the shopping cart and the fridge and whatever. I just liked it all to be perfect. And now with 3 kids, it doesn't happen. I've had to give up on it. And I want you to hear that. I told you that is something I prefer to do. I liked things that way. I felt like, all right, well, I'll spend my time putting it away neatly, and then I'm not spending my time ironing things or looking for things. So it was just a choice. Where are you putting your time? But if I couldn't get it done, or like I can't right now, it's not causing me distress to not do it. Things are not, say, the way I prefer now, but I'm okay. Like, so it's just simply not the way I prefer. Where if you see somebody who, let's say, likes to have things very organized, and they have an obsessive compulsive disorder, to put stuff out of order would cause a substantial amount of distress. So I can tell you, knowing of somebody that had an OCD, if you took something from their cabinet, like, and just everything was all lined up really much the way I would like it, or used to keep things, but you go and turn some cans around or move something around so that it's messed up. They don't just roll their eyes like I would and be like, oh, okay, somebody's being funny. They would get very upset, start to hyperventilate and cry, take everything out of like their pantry or their cabinets and start washing everything down, boxes of pasta, cans of soup, whatever they have, washing it all and putting it back, calling out of work. You see the difference there. One is taking a substantial amount of time, and it's causing a marked distress, where the other is just, it's just a preference. So knowing of somebody who had OCD, they had this compulsion to buy $2 items. And so every time they saw an item that was, $2, they would purchase it. And there are stores where clothing items. There are stores that when they're like getting rid of stuff, they just will put everything on something in like on a rack like that, $2 rack, and this person would buy everything. And it didn't matter if it was baby clothes or size 14 or 3. It just made no difference. It was $2. And so they bought it, and they had entire rooms in their house that they couldn't go in because the clothes were just stacked from floor to ceiling. That's a different, like, you see the hoarding symptoms there, but there were also the symptoms of obsessive compulsive disorder there. Another compulsion that I saw with somebody was this obsession and compulsion, I should say, together. This thought that somebody would one day give them a gift and they wouldn't have a gift to give somebody in return. And so they would buy gifts for every, like for whatever gender, any age, at varying price points, wrap them all, put a little tag on it that says like, or this is for like a 7-year-old girl, this is for a 14-year-old boy, whatever. And that way, if anybody ever gave them a gift, they could be like, oh my gosh, I got something for you too, and then go into the room in their house or rooms in their house where they kept these gifts. And now the person that I know that did this, I never knew her to need to go into that room to get a gift, but this person was so afraid that this would happen that she was prepared for it. Now that's more like, again, the hoarding, but the disordered level of activity, where if any sort of disruption in this would cause a substantial amount of distress, and not being able to use whole sections of your house because of what you have to kind of keep in line. But it is common that people with OCD would like get trouble with, it's like troubling thoughts, these bad things. I have a thought that's bothering me, something that's distressing. It's just a thought, but they'll like kind of grab onto it and they think it's more meaningful or that it would cause something. And so they spend a lot of time in trying to prevent that sort of thing from happening. I think one of the worst cases of OCD I've ever even heard about was in a book. I think it's called Life in Rewind. And in this book, this guy, he witnessed something horrible. He was sent to his room. I don't know if I'm giving it away, but just give you like the basics. You could certainly read the book. But like he was, in his room, he was punished. His mom was sick. She was dying, and he heard her make some noises. He went into her room. He happened to be there the moment that she passed, but he had been sent to his room. He had gotten in trouble. So he ran back into his room and didn't tell anybody that he saw this, and became obsessed with like preventing death after that. He thought that like his not doing what he was supposed to do somehow caused this to happen. And being a kid and not saying anything, that nobody was, rational with him about that. Nobody really helped him through it. And so he thought that he could prevent death by preventing the passage of time. And the only way to do that was to rewind everything, which is impossible of a task if you think about it. Like, you just want to go upstairs. He'd have to think of where every part of his body was and how it felt on every step, and he'd have to do it in one direction and then do it in the other direction. And if he went backwards going down the stairs trying to rewind it and it didn't feel right, then he had to like rewind the mistake that he just made in that too. So the simple act of going up and down the stairs could take all day. That is one of the worst cases, or the most difficult cases I've ever even heard of this. So the book is interesting because where this guy is talking about his OCD and the treatment and whatever, and I think it's just amazing that he did end up in a healthy life afterwards. I don't want to like describe more than that, just in case you want to read the book, but it was really interesting. They have actually seen in PET scans of people who have OCD that their brains do reveal unusually high activity in the frontal lobes just above the eyes, and this strengthening of the sphere circuits between the frontal lobe and the amygdala. Okay, and so finally, body dysmorphic disorder. This preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear merely slight to others. There's repetitive acts or mental acts due to the appearance concerns. So excessive grooming or mirror checking, picking at the skin, reassurance seeking, or excessive comparison to self to others. There's significant distress or impairment, and it can't be explained by an eating disorder. If somebody has anorexia or bulimia, we wouldn't diagnose a body dysmorphic disorder. You would treat the eating disorder in that case. A point I want to make about body dysmorphic disorder, again, like with you guys kind of hearing about this stuff potentially for the first time, not really knowing what it looks like, everybody has perceived defects in their physical appearance. Something that bothers them, or even for a period of time, or this is normal, completely normal. It's not normal to be so obsessed with it that you can't go places, or that you are looking for surgeries to fix stuff that people don't even notice. It wouldn't be normal to be so embarrassed or ashamed or anxious that you avoid social situations, or engaging in numerous cosmetic procedures to try to fix this perceived flaw. And then, at the end of it, somebody with body dysmorphic disorder, maybe has surgery to fix something, and it only brings them temporary relief. And then their anxiety about it returns and they need to fix it again. Some common areas, though, would be to focus on the face, your nose, complexion, wrinkles, acne and other blemishes, hair thinning, baldness, skin, vein, breast size, even muscle size and genitalia. But I caution you when you look at this, again, just because you or somebody might be upset with something, or think something about their body that is not true, or worry about it too much, it has to cause a significant amount of distress, disability, or both. It has to interfere with your ability to function in a normal way for it to be a disorder.